Thank you. The number of new coronavirus cases in America is dropping, but the experts warn the decline may not last. The last 2 weeks, the average number of daily reported cases is down by about 18%. That's good, to about 34,000 per day. Still not so good. This fall and winter, though, are expected to bring new dangers. Our lead national correspondent, David Begnaud, reports on how colleges have now become the hotspots.
It was another weekend of parties around colleges and universities. Young people gathered in Washington Square Park near New York University for the second consecutive weekend. This crowded house party took place near the University of Kansas, and this video of a party near Florida State University shows very few people wearing masks. According to a New York Times survey of more than 1,600 schools, colleges and universities recorded more than 36,000 coronavirus cases in just the last week. An outbreak at Michigan State University has county health officials urging all students to self-quarantine for 14 days. But not everyone is convinced that that plan is going to work long term.
Eventually, most people are going to get it.
And that is exactly what worries infectious disease experts like Dr. Michael Osterholm.
With the colleges and universities openings, with the spillover that's occurring, with people experiencing even more pandemic fatigue, we're going to see these numbers grow substantially.
This morning, there are encouraging signs on the vaccine front. Listen to what the CEO of Pfizer told Margaret Brennan on Face the Nation.
In our base case, we have quite a good chance, more than 60%, that we will know if the product works or not by the end of October.
The vaccine, developed by the University of Oxford and AstraZeneca, will resume clinical trials in at least 2 countries. This comes just days after they were put on hold. CBS News medical contributor Dr. David Agus.
A neurologic side effect happened in a second patient. The trial was stopped, and it was reviewed by an outside group of people called a Data Safety Monitoring Board. All of them felt that it was not related to the vaccine, and therefore they could proceed with the clinical trial of the vaccine, that the benefit was obviously significantly greater than any potential chance of harm.
So there you go. AstraZeneca said in a statement to CBS News that they're working with health officials now in other countries, including the FDA here in the U.S., to try and get other trials back up and running. Now, Dr. Agus, who you just heard there, said he is confident we're going to have a vaccine, at least one, by this fall. And Gail, he told us that he thinks within the next 9 months, it could be another 9 months before we have enough vaccines for everyone here in the U.S. who wants to get one.
So that means we're still in the middle of this, David. So the numbers are dropping, but they're still high in terms of the number of reported cases and the number of deaths. But we look for any silver lining. Thank you very much, David Begnaud. Always good to see you. I had the